I think it makes the biggest impact if there's a language barrier in mental health. Certainly, if the treatment provider and the patient and or family have trouble because of language, the nuances of what they're experiencing from a mental health perspective is going to be missed. The ability to follow up with questions in detail will be missed. It will be more a cursory type of evaluation where you'll get a gist and you'll often jump to a treatment just because you feel you need to do something. So language, uh, ability to understand, communicate in the same language, is a significant first step when evaluating an individual, whether it may be some mental health concerns. That being said, if you, even though you may not have the culturally perfect fit, it's still prudent that all individuals that are getting a mental health evaluation and providers still have some ability of completing an assessment as complete as possible. Maybe bringing in somebody, maybe using their family, as a translator. We have to use the tools that we have because it's never going to be a perfect fit and that you have everything you need for the most comprehensive evaluation. The second thing, many people from these communities that are marginalized, let's say Hispanic American, African American, we have a shortage of those cultures in mental health today. We don't, for the number of people that have mental health concerns from marginalized communities, we don't have enough practitioners that have that same background. So that also sometimes leads to a fit. We may also have, as I mentioned, deserts and what I mean by that is not having practitioners practicing in those communities. So in those communities, it becomes even more important that the primary care doctor, the family medicine doctor, develop some competency in mental health evaluation and treatment. They're also maybe more trusted, that an individual may be more comfortable or family with a pediatrician, with a primary care doctor that may be treating other medical conditions. So there are programs that are trying to go to these marginalized areas, specifically with providing some behavioral health, mental health education. So now they can ask the right questions for depression, anxiety, substance abuse, maybe even schizophrenia, bipolar disorder. So that is a step forward. We are recognizing the challenges in marginalized community, and we're trying to address them through this being one mechanism, training the people that are on the front line. Well, I think it's to be, engaged, in healthcare discussions, debates. Right now, this may not sound like a more common way in a frontline, but voting. It's as simple as something, voting, understanding the issues, the people that are running for office. In mental health, it's often been shown, there's a little bit lower, registration rate for voting and being engaged. So that's one simple thing. And we've also found when people do engage in voting, their well-being, their health is better. They now feel more connected to society. I know that's sometimes a challenge in marginalized community just because of fear. That's often created. But the most simple thing that doesn't really require, all these legislative, changes and more monies in healthcare, just voting and being engaged, because healthcare is part of every candidate and almost every issue there's some form health. So that's one. The second, for parents, to be involved in the school where their child may be in school, and where schools are doing their best to provide some mental health, like screening training for teachers. So, being comfortable when they notice something at home, not quite sure to address it. The school is a good place. The vast majority of, children will be in school in some capacity. Second is, parents to, we need to support them in getting some tools and, understanding of what is depression, anxiety, sleep challenges, all these different stresses. Third, the comfort with sharing with your primary care doctor what you're experiencing. And that could be a nurse practitioner, a physician assistant, but how can we support individuals to share what they're experiencing psychologically and or psychiatrically? Within families, having families become comfortable of sharing what they're observing. And then finally, for all of us that maybe have a little bit more comfort, when we see something or someone, within our close, social community, it's normal human behavior to retreat. That's not my business. But we have to change that mindset. Like if I see yourself, Lana, like someone I know for a long time, and if I've known you and I see you're not quite as bubbly and you're not quite as, coming to all the activities we used to do, you're responding to my texts and all. My job is to really reach out to you. How are you doing? Just that question, how are you doing, is so powerful. Your response may be, I'm doing okay, but now you've planted in your seed, hey, I asked. And so that's happening in schools now. If you go to assemblies, you go to their 0 period. This is one of the focuses. We have a responsibility of taking care of each other. And that certainly, I think, would be the message I would say to marginalized communities. You all, look out for each other. And I can guarantee you when I do reach out inquiring how someone's doing, and they may be doing great, and my interpretation was wrong. I get as much out of it as you might in my reaching out, because that's what we're all about. Ultimately, we're going to conquer mental illness by being socially connected.